You know the drill. It's 11 p.m., you're scrolling through Muscat clinic websites trying to figure out what a smile makeover actually costs, and you end up more confused than when you started. One site tells you 80 Omani riyals per tooth, while another just vaguely advertises a smile package with 0 numbers attached. The pricing across Muscat isn't actually random. The problem is how clinics present it. They almost always quote on a per-tooth basis, which intentionally makes that initial number feel small and highly accessible. When a dentist refers to a smile makeover, they're talking about treating the 6 to 10 upper teeth visible when you smile. So that seemingly cheap per-tooth price quickly gets multiplied by 6, 8, or 10 before factoring in anything else. And that's just the baseline. The massive gap between the advertised sticker price and the final number on your bill comes down to a specific set of hidden factors that clinics rarely disclose before you sit in the chair. To accurately gauge what a veneer treatment will actually cost in 2026, we have to treat the quote like a forensic audit, moving completely past the advertised price to deconstruct every item on the final invoice. The first major variable we have to audit is the material. If you look at standard clinic rates, you'll see a massive 3-to-1 price difference between composite veneers and premium options like porcelain or zirconia. Composite is your cheapest option, usually running between 35 and 70 Omani riyals per tooth. The cost is low because the dentist sculpts the resin directly onto your tooth in a single, fast chairside visit. You are paying strictly for their time. Porcelain and zirconia jump up to between 90 and 220 OMR per tooth. That increase accounts for a much longer timeline. Your dentist has to take physical impressions or digital scans of your mouth and send them away, stretching the process out over multiple weeks and visits. You are now paying a hidden manufacturing cost. A dedicated dental lab takes those impressions and spends 1 to 2 weeks hand-fabricating custom ceramic shells to match your exact shade and bite alignment. Zirconia sits at the absolute top of this pricing tier because of its specific material properties. It is an ultra-durable, highly chip-resistant ceramic specifically recommended for patients who grind their teeth in their sleep. The gap in material cost isn't a marketing trick. You are paying for the shift from a local dentist's immediate labor to highly specialized external manufacturing. Location and expertise drive the next chunk of the invoice. Clinics in premium areas like Al Mouj or Quorum routinely charge 15 to 25% more than neighborhood practices, reflecting higher real estate overhead and the proven track record of their cosmetic specialists. This chart compares lab sourcing costs. Premium clinics frequently outsource the ceramic fabrication to overseas labs in places like Germany or Korea, rather than local Omani labs, to ensure a highly precise fit and finish, a choice that pushes your total cost much higher. Let's look at how this plays out in practice. A 30-year-old patient in Muscat recently went in for a consultation and was quoted 660 OMR for 6 porcelain veneers to even out her smile line. But her final invoice came out to 685 OMR. The clinic required a mandatory scaling and polishing session to prepare the teeth before starting the procedure, and that service was completely unbundled from the main quote. You have to watch out for these unbundled extras. Many patients are surprised to find out they are billed separately for the temporary veneers they wear during the waiting period, or even for the follow-up fitting visits to check their bite alignment. This is also why flying to Dubai often doesn't make financial sense for veneers. While medical tourism packages might look cheaper at a glance, the flights and hotel stays required for those multiple ceramic fitting visits usually erase any potential savings. A low initial quote means absolutely nothing if the clinic operates by unbundling every single mandatory step of the medical procedure. The smartest way to evaluate a veneer quote is to stop looking at the cost on the day of the procedure and start calculating your cost over a full decade. This timeline tracks the typical lifespan of the 2 main materials. Composite veneers usually last 5 to 7 years and require periodic touch-ups or complete replacements. Porcelain and zirconia, if cared for properly, can last 10 to 15 years without needing intervention. You also cannot rely on health insurance to soften the blow. Standard plans in Oman classify veneers as elective cosmetics, meaning they offer 0 coverage unless you have hard documentation proving the tooth was damaged by physical trauma. However, there is a local financial workaround. Many Muscat clinics quietly offer interest-free installment plans that let you split the total across 3 to 6 months. They rarely advertise this upfront, so you have to ask about it directly. Before you agree to any treatment plan, get at least 2 separate quotes. Prices vary so heavily between clinics that a second opinion will frequently uncover a 15 to 20% price swing for the exact same quality of work. Demand a fully itemized list of what is bundled into that quote, and ensure the material you are paying for actually matches your timeline. A short-term fix for a wedding requires a completely different budget than a long-term investment. Your final payment covers a decade of structural durability, the specific skill of the dentist, and the unseen quality of the fabrication lab. The white tooth is simply the part you can see.